my name is Andrew Green, ADN student at Wilson State College, and today I'm going to be demonstrating hanging a secondary line for Piggyback. So first I'm going to enter my bedroom and check my healthcare provider orders. So I see I have my healthcare provider orders here in my MAR, and I'm going to check I have the correct patient. So I have patient Shirley Coast, 514 of 64. Okay, and I see that the provider has ordered ceftriaxone 1 gram and 250 milliliters of sodium chloride over 60 minutes. 1 gram. 250 milliliters over 60 minutes of ceftriaxone, so that matches. And I have the correct patient, and the night nurse hung sodium chloride at 5:30, so I know that that is compatible, and I know that this client specifically needs this antibiotic because they have a current infection. So I know that this medication is warranted. So now I'm going to grab my medication from the Piggyback. So I have my unopened bag of pre-mixed ceftriaxone. So I'm going to check for color consistency, make sure there's no powder, that it's mixed correctly, that the expiration date is good. And I would have my medication label placed on here so I can do my first med check as well. I'm going to place a patient label. So once I know that the IV solution is patent and okay to administer, I'm going to do my first med check and my first patient check. So patient Shirley Coast, 514 of 64. So I know that that matches, and now I can do my first med check. So I have ceftriaxone 1 gram, 250 milliliters of sodium chloride over 60 minutes. So I know through dimensional analysis it's going to be 250 milliliters per hour. So I have this that I can take in, and I'm going to grab my unopened secondary tubing to hang the Piggyback with. So I'm going to make sure that the packaging is tampered with, that the tubing looks okay, and that it's within expiration date. And then before I leave the bedroom, I'm going to do one more med check. So I have ceftriaxone 1 gram and 250 milliliters of sodium chloride to infuse over 60 minutes. So if that's all good, I'm going to head to my patient's room with my supplies. Now provide privacy. Hi Shirley, how are you today? You're doing good? Okay, can I get you to confirm your name and your date of birth for me? Shirley Coast, 514 of 64. Okay. That matches, and I see you have an allergy. Can you tell me what your allergy is? Codeine, okay, that matches with my arm. We're not going to give you any codeine today, so that's okay. I have an order for you from the doctor. It's a new order for an antibiotic for your current infection, okay? I'm going to hang that. It's going to go in through your IV. Do you have any questions? No? Okay. So, as well, I'm going to check my patient label with the wristband just to make sure that I have the correct patient. Here we go. 514 of 64. Perfect. Okay. So then I'm going to perform hand hygiene again, and I'm going to continuously talk to my patient, assess the IV site, make sure that they don't have any questions or they don't need anything. I'm just going to find some blood. And then I'm going to do my third medication check before I prime the tubing. So I have ceftriaxone 1 gram. 250 milliliters, to infuse over 60 minutes. So you know that as well, I can take it out of the packaging, as well take my secondary tubing out of the packaging, and then I'm going to begin to prime this. So first I want to make sure my roller pump is closed. And we're going to spike the bag, keeping both of these tips sterile using a aseptic technique. And once that is spiked and I know my roller pump is closed, I can hang the bag. So the fluids would be infusing into the patient's arm, but right now we have it into the garbage can because the arm itself isn't cooperating very well. So I'm going to squeeze my drip chamber to about halfway. And then before I prime, I'm just going to clean my tip here. (10 to 15 seconds in circular motion). And while that dries, and before I prime, I'm going to do one last med check just to be sure that I have the right patient and medication. So Shirley Coast, 514 of 64. ceftriaxone, 1 gram, 250 milliliters of sodium chloride to infuse over 60 minutes. Okay, so that all matches, so I'm good to prime my tubing and administer to the patient. So I'm going to take off this cap. And I'm going to slowly prime. And make sure there's no air bubbles in the line. Making sure to keep this end sterile. And make sure to get all the air bubbles out. Okay, so once all the air bubbles are out, and I've already cleaned this, I can connect this to my pump. And I've done my 3 medication checks. I know I have the correct patient. So then I'm going to set the primary or the secondary rates. I'm going to go B. I'm going to find ceftriaxone. I'm going to go dosage count. And I know that it's 250 milliliters to infuse over an hour, so I'm going to go 250 and 250. And then I can start. So then I'm going to stay with my patient for 15 minutes, monitor any adverse reactions, make sure they don't have an allergic reaction or anything like that. And then after an hour, the machine's beeping and I can stop the infusion. So we're going to go B, and we can stop. So all of this has been infused, and we have stopped B. Okay, so B is stopped. Okay, so now we see that B is stopped and A is pumping. So I'm going to leave this bag hanging in case for when they need more antibiotics, and then the tubing stays sterile and primed. And then make sure that this is infusing, make sure that I monitor the IV site, make sure the client is still doing okay. And I'm going to go back and I'm going to document the time I started the antibiotic, the time I stopped it, how the patient tolerated it, that there was no allergic reactions or adverse reactions, the IV site assessment, as well as when I restarted this bag as well. And then once I know that all of my patient safety needs are met and my documentation is done, then I'm completed.